Hey everyone, we're continuing chapter 16. We just finished talking about the spinal cord, and now we're going to talk about the nerves that come out of it. We're talking about spinal nerves. To understand spinal nerves, I first have to show you this funny looking picture of this guy leaning over. This is a mapping of where nerves innervate, where spinal nerves innervate. Let's take a look at the far left first. If you take a look at the far left, what we see is a brain, and then hanging off that more caudally the spinal cord. And we have different sections. We have cervical, thoracic, lumbar, and sacral. Coming off of each section, you have pairs of nerves. So there'd be a pair of nerves coming off this way, and here, and so on for every little section you see. Remember, there are 8 cervical nerves, pairs of cervical nerves, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal. Those nerves innervate different parts of your body, different muscles, and different areas of your skin. And that's what this picture is showing. This picture is showing here in pink, well, actually more accurately here in pink, the areas of your body that are innervated by cervical spinal nerves. Here in purple, the areas of your body that are innervated by thoracic spinal nerves. In green, the areas of your body that are innervated by lumbar spinal nerves. And in blue, it should say sacral and coccygeal nerves. 2 C's, coccygeal, there we go. As you notice, I didn't circle the face. That's because the face is not innervated by a spinal nerve, it's innervated by a cranial nerve, specifically by the trigeminal nerve. And that's what you see here. I'm going to put this in red. Trigeminal nerve is innervating your face. You've got that ophthalmic, maxillary, and mandibular divisions. The term for this is a dermatome. Derma refers to skin. I forget the exact etymology, but it's relating to some kind of mapping. And we have each nerve branching and innervating. So these are dendrites over here, or axon terminals, depending on if this is sensory or motor, going to and from the spinal cord, innervating specific regions of your body. That's what a dermatome is. So I show you this funny looking picture of a guy leaning over to help the mapping make more sense when we look at it when the person is standing straight up. Take a look, let me isolate one half. Take a look at this from an anterior view. When we look at this from an anterior view, we can see cervical in the neck area, but then in parts of the arm. Thoracic mostly in the chest area and abdominal area as well. Lumbar in the anterior leg. And then if I bring up the posterior, you'll see more lumbar, more sacral in the posterior leg. Sacral is more in the posterior leg. Once again, the definition of dermatome is an area of skin innervated by these branches of spinal nerves. So it's innervating skin, so you can feel touch, temperature, pain, itch, somatic sensation. Also could be for control of muscles in those areas. We're going to go over specific spinal nerves and the muscles they control. This is a useful mapping. We can use this as a tool to identify if we have nerve damage, and if so, which nerve could be damaged. We mentioned sciatica at the beginning of the previous video. Sciatica is where you have a shooting pain down your leg. It's generally in the posterior side. If you have shooting pains down your leg, mostly on the posterior side, you can see that's going to be in this sacral region. It's a nerve that innervates that's coming from the sacral part. It's a sacral spinal nerve. We'll learn what the sciatic nerve is. The sciatic nerve is a sacral spinal nerve. If you hit your funny bone on your arm, The shooting, tingling, or pain goes on your medial part of your arm to your digits 3, 4, and 5. If we take a look at our diagram, we can see it's most visible here on the posterior side with T1, maybe an overlap with C8. There's often overlap for regions. There's a nerve here called the ulnar nerve that's innervating this part. There's a lot of nerves. We're not going to go over every single spinal nerve like we did with every single cranial nerve. We didn't even go over every single branch of every cranial nerve. We just went over some branches. But with the spinal nerves, there's a ton. I'm not going to ask you to remember every single one. We are going to go over some important ones that I feel are important. Some of the bigger ones. Some trends that you can also notice is that these nerves tend to branch a lot. And these branchings get really complicated. That you form a network of intersecting nerves. So let's say, take a look at the top here. Let's say you have 3 branches. The branches, or let's say they each come from 1. They can branch separately, but they can still branch together and then branch separately again. They form a very branchy, interconnected network of nerves. The term for this is a plexus. They form nerve plexuses. And we see this in regions of the body where we have more to sense from or more to control. If you take a look at our diagram over here on the right side, let me change colors. The plexuses gather in the neck region. So that would be the cervical plexus between C1, spinal nerve C1 through C5. For the arm, because you have a lot to control or sense here, that's the brachial plexus. To the arm is the brachial plexus. There is no plexus between T2 to T11. Whoops, too much. Between T2 to a T11, because even though your chest and abdominal area physically take up a lot of space, there's not as many muscles to control here. And in terms of sensitivity, this is a lower sensitivity part of your body. Your hands, for instance, are highly sensitive, so you need a lot of nerve endings here. And so there's going to be a lot of nerves going to and from these areas. Thoracic area, abdominal area, relatively fewer number of muscles to control, skeletal muscles to control. And while there's more surface area, there's less sensitivity, so there are fewer neurons. So there's no plexus associated with T2 to T11. There is another plexus lower down, the lumbar plexus. Lumbar plexus between T12 to L4. This is going to control parts of your leg or sense from parts of your leg, and then sacral also from parts of your leg, L4 to S4. Let's take a closer look at each of these plexuses and some of the major nerves that come from them. In the cervical plexus, we're innervating once again skin and muscles of the head, neck, and chest region. The cervical plexus is unique that since it's so close to the brain, these spinal nerves can branch along with cranial nerves. So you do get branching of cranial nerves intermixing with spinal nerves, specifically number 11 and number 12, accessory and hypoglossal, which makes sense since they're the most caudal. The cutaneous branch of the cervical plexus innervates the neck region, the cervical region, and the posterior head, the occipital region. The muscular branch of this cervical plexus innervates muscles of the larynx so that you can speak, for instance, the diaphragm for breathing, rhomboids for retraction, serratus anterior for protraction. Still need to know those movements and what joints they control. That'll be important. One nerve coming from this branching plexus that I'm tracing over right now that I'd like you to know is this one that goes down farther. This is called the phrenic nerve. Phrenic. The phrenic nerve controls your diaphragm, which I'm drawing in here. Controls your diaphragm muscle. So it's a really important nerve. We need to control our diaphragm for normal breathing. I included here what could happen if you damage this nerve. If you have damage, that could lead to a cessation of breathing. You stop breathing. That's what respiratory arrest means. Arrest means to stop. If you stop breathing, you will die. You'll suffocate. It's thought that if you irritate this nerve, that can lead to hiccups. Yeah, so it's affecting your breathing. Could lead to, if you damage it, you could stop breathing completely. Phrenic nerve is a nerve that branches from the cervical plexus. Combination of C3 to C5 spinal nerves that form this nerve. Let me actually trace that. So how this makes sense. How does it come from C3 to C5? C3 is right here, C4 is right here, here's C5. They branch together and then form the phrenic nerve. Here. So there's one nerve that I'd like you to know in the cervical plexus. There's 5 that I'd like you to know in the brachial plexus. In the brachial plexus, we're innervating muscles of the pectoral girdle, muscles and skin, so sensation and motor control of the upper limb, the arms. Oops. 5 that I'd like you to know. The first is the axillary nerve. The axillary nerve is innervating your armpit shoulder region. Here's the axillary nerve. Since you're innervating the shoulder region, you're innervating muscles like the deltoid and teres minor for actions like glenohumeral abduction and rotation. Musculocutaneous. It's innervating muscles and skin. Honestly, not the best nerve name. It's very generic. All these nerves innervate muscle and skin, but the musculocutaneous nerve, which is right here, it goes more distally on the arm. It goes more distal. So you're going to and also anterior, distal and anterior. It's innervating muscles like the biceps brachii and brachialis. Distal, anterior, a little more distal. It's the proximal part of the arm, but anterior part of the arm, biceps brachii and brachialis. So it's going to be used for humeral radial ulnar flexion. The radial nerve goes towards the radial side of your arm. It's going to go even more distally and laterally. So it's going to innervate muscles like your brachioradialis. It does stop over and innervate your triceps brachii, so you can have flexion of your humeral radial ulnar joint and extension. Since it goes down to the wrists, you're also innervating your extensor carpi radialis longus, your extensor carpi ulnaris. Since the extensor carpi ulnaris comes a little more posterior. So you can use this for extension of your intercarpal joints. That's the radial nerve. The ulnar nerve is going to be more medial. The ulnar nerve branching from the brachial plexus goes primarily of the muscles that we've discussed to the flexor carpi ulnaris for flexion of your intercarpal joints. And then the median nerve, this is the one that goes through the carpal tunnel. The median nerve, the nerve that goes through the carpal tunnel along with all those flexor tendons. This is for innervating things like flexor carpi radialis and palmaris longus. It will be important to know which nerves, where these nerves are located and what they are innervating, and therefore what actions they help cause. Or let's say if you damage a nerve, what action could you no longer do? Or what area of your body could you no longer sense? Again, no thoracic plexus, so we're moving down. Now we have the lumbar plexus. The lumbar plexus coming out between T12 to L4. So all of this. There are two major nerves that I'd like you to know. The first is the femoral nerve. The femoral nerve comes anteriorly, anterior femoral region. It comes down and branches in front of the leg. So it's going to innervate your quadriceps, your rectus femoris, vastus medialis, vastus intermedius, vastus lateralis, sartorius, iliacus, psoas major. So for flexion of your femoroacetabular joint, extension of your tibio-patellofemoral joints. The obturator nerve, which is right, it doesn't show the whole thing, but I'm going to draw it in. The obturator nerve is going to innervate your medial femoral region. And by innervating the medial femoral region, we're getting the adductors. Gracilis, adductor magnus, adductor longus, adductor brevis. So for adduction of your femoroacetabular joint. The sacral plexus is right here. The sacral plexus is innervating your posterior leg. So the hamstrings group, biceps femoris, semitendinosus, semimembranosus, that's innervated by the sciatic nerve. That name should sound familiar, besides sciatica, which is a damage to this nerve, but remember the greater sciatic notch, that big notch on the posterior side of the coxal bone? It passes through that bone, or that part of the bone, the sciatic nerve, hence greater sciatic notch. This sciatic nerve, as it travels distally, will split into the tibial nerve, which will innervate the tibialis anterior for dorsiflexion, and then the common fibular nerve, which will innervate fibularis longus, but also gastrocnemius and soleus for plantar flexion. So 3-ish nerves here. It's really one nerve that splits into two. Sciatic nerve, tibial nerve, common fibular nerves are ones that I'd like you to know. This map will be important to know for the upcoming quiz, the one that this chapter is included on. You will be provided it. So knowing how to read this is more important than memorizing it. When you look at this, this is from an anterior view on the left side, on our left side. Here's a posterior view on the right side. We can see that specific nerves are innervating different areas. So for instance, if I asked which nerve, there's usually more than one answer, but which nerve innervates pectoralis major? Pectoralis major could be innervated by any of these C5 through T4, since pectoralis major is in this region. Or if you want to innervate tibialis anterior, you're covering a lot of that here with L5 nerve. Or let's say you feel pain in your pollex. If you feel pain in your pollex, then that would be C6. You're sensing something with your C6 spinal nerve. Spinal nerves are mixed nerves. They're both sensory and motor. And then hopefully you could do the same thing on the posterior side. It will be really useful for you to look through the videos on YouTube here that I've made previously, showing the different models of where the nerves are. Take a look at the week's videos for the list of Ackland's videos that I provided, so you can see this in a cadaver. And I want to show you real quick in Complete Anatomy some cool functionality that you can use to help you with these spinal nerves and dermatomes. If you go in to Complete Anatomy, open up a model, I have the skin on. Get my drawing on. Take a look down here. I've turned skin on once. If I click on this again, whoops. If I click on this again and hit plus, I get the dermatome. And this is going to be really useful. So now I can look around which cranial nerve, or excuse me, which spinal nerve is for innervating muscles like the triceps brachii. Triceps brachii would be innervated by C7 and maybe a bit of C8. You can look at things like that. So that's one really cool thing you can do here in Complete Anatomy. You can look at the dermatomes. It even shows you those the branches of the trigeminal nerve. If I turn that off, let's turn muscles on. Another cool thing you do, let's say you want to learn more about the triceps brachii. So I'm going to click on triceps brachii. All right, I've clicked on it. Now take a look on the left side at this menu right here. I'm going to scroll over, and you see where it says nerves? Where it says nerves right here. I'm going to click on that. Whoops. Click on that. There we go. It tells me that the innervating nerve is the muscular branch of the radial nerve. So the radial nerve, can you see that right here? The radial nerve innervates the triceps brachii. We're confirming what we knew, what I've shared with you earlier. You can even highlight the innervation path. I'm going to click on highlight the innervation path. And you can see the radial nerve extending from that brachial plexus. You see the brachial plexus over here? Brachial plexus, we branch and we finally get our radial nerve. We can see it innervating the triceps brachii, among other things. So that's a really useful thing that you can do here in Complete Anatomy. A lot of things to know and a lot of resources to help you with it. So I encourage you to check out Complete Anatomy, Ackland's, and the videos of me pointing stuff out on the models. Thanks, everyone. As always, let me know if you have more questions. If you need help navigating Complete Anatomy or Ackland's or my videos, I'm happy to do that. Let me know. Leave questions in the comments. Thanks for watching. I'll see you all later.